It's the leading cause of blindness in the United States, and the older you get, the higher your risk of suffering from macular degeneration.
Here to tell us more this morning is Dr. Omar Punjabi with Charlotte Eye, Ear, Nose, and Throat Associates. Dr. Punjabi, good morning. Thanks for being here today.
Good morning, Colleen and Larry.
Good
Thank
morning.
you so much for having me.
Of course, it's our pleasure. Okay, first off, let's talk about macular degeneration. How common is it?
Well, macular degeneration, as you mentioned, is the #1 cause of permanent blindness in the United States in individuals over the age of 65. And with the baby boomer population rising, the prevalence is increasing every year. We see more and more people on our doorstep with this disease, and in fact, they estimate about 1.75 to 2 million individuals in the U.S. are living with this condition.
2 million. It's a lot of people.
These people, are they living with it and don't know it, or some do know it and some don't? Is that how it works?
Well, that's a good question. Unless you get an eye exam, you may not know that you have it, because early on in the disease process, there are no symptoms. But then as the disease progresses, you start losing vision.
What exactly is macular degeneration?
Well, macular degeneration or age-related macular degeneration is a condition where as you get older, you can see on the left there's a picture of a normal retina, and on the top right is a picture of a patient with the dry macular degeneration. As you get older, you see these yellowish deposits called drusen, which start accumulating and cause cell death. And in the bottom right, you see a picture of a patient who has a hemorrhage, and that's the less common wet form of macular degeneration where there's leakage and bleeding. So you can see why these patients come in with vision loss, because their central retina, or the light-sensitive layer of the eye, is affected by this condition.
Who is at risk of developing this?
That's a great question. So anyone is at risk, but there are certain risk factors that put you at a higher risk of having this condition. The most important is advancing age. You know, we start seeing this condition develop in someone as young as in their 50s, but then as people get to their 60s, 70s, and 80s, the prevalence rises. The other risk factors are family history. So if you have a sibling, if you have a parent, or if you have a grandparent with this disease, you're much more likely to get it. This disease is much more common in Caucasians or individuals with green or hazel irises, and less common in someone who's African American or with a brown iris. There are some modifiable risk factors which we tell patients these are the 3 or 4 things you can control. #1 is smoking. There's a very strong association between smoking and macular degeneration. Whether it's cigars or cigarettes, any kind of nicotine intake can make it worse. The other risk factors are sun exposure. So if you've been out in the sun and exposed to ultraviolet radiation, your risk of this progressing is much higher. And then finally, diet plays a key role as well. So patients that have a lot of saturated fat, they tend to have a higher risk of progression. Antioxidants are protective.
What are some of the symptoms so you know that you're suffering from this?
Right. As we talked about, the scary thing is a lot of patients have no symptoms. And so it's picked up by the eye doctor on a dilated eye exam. But once patients start getting symptoms, they'll come in with blurred vision, difficulty with reading, inability to read street signs while driving. And also a lot of times patients tell us they need more light to read, which causes decrease in sensitivity of the retina. And another symptom is metamorphopsia, which basically means people say that they see straight lines wavy or crooked, which causes their vision to deteriorate as well. And the one thing I'll mention is in macular degeneration, it's rare to lose your peripheral vision. It's usually your central vision that's affected the most, unless it's a large bleed, which can affect all your vision.
Quickly, can you tell us, are there treatments for this?
Yeah, there's some very good treatments available for the wet macular degeneration, but we tell our patients, do not get old. But, in all honesty, for the dry macular degeneration, there's no good treatment. We tell patients about antioxidants and supplementation of certain vitamins called AREDS2, like Preservision or Focus. Stop smoking, things like wearing sunglasses would help. For patients with the advanced form of macular degeneration, there's low vision aids like telescopes, handheld illuminators, magnifiers, which might help. prevent the progression, or at least help them with visual aids if they're, visually needing help. And then finally, for the wet macular degeneration, we have some excellent treatments which are in the form of medications that are painless injections in the eye.
Well, make sure you go, make an appointment, get your eyes checked. To learn more, call Charlotte Eye, Ear, Nose, and Throat Associates. The number is on your screen. It is 704-295-3000. And their website, goodsenses.com, goodsenses.com. Dr. Punjabi, thank you so much.
Thank you so much for having me.
Great to have you here today.